Okay. Okay, on a good afternoon, Akushe, on a cabo. My name Natimu John Fuller. I'm the program host of the Bɔdi Bεttεh Gentri program. We're at the organization of Greater Manchester and they bring and come to we. Today we do menopause. The ins and outs of menopause. All the thing we need for know. Dr. MSI Kamara I will present for we today. And before we start, I will just introduce the team to a quick. Then after that, Dr. Kamara will start. The Equal City organization of Greater Manchester and they bring the program to we. And the people that they present to we on all them programs here, and salon people them, now we own people them, now community. We don't learn book but medicine and they bring them program here to we. Okay, and in the list, Dr. MSI Kamara, now they present to we today, Dr. Mohammed Kamara, in an emergency medicine consultant at Greater Manchester now. So now they present to we today. So I will see I'm a lot and I will hear from a lot. Okay. The next person, Miss Gugia to Kamara, when a mental health nurse and a health visitor. Something they can put in or instead can present story regarding mental health and all the subjects them said in the panel. If you get any question we relating to that, it will come in and give your advice. Okay. The next person will get Mr. Ibrahim Sise when a qualified social worker and also a mental health advocate. I don't know what to make me tongue the tie today. Okay. Next person, Miss Fatima Kuroma. We not do it today, but normally I can talk to we about the type of food they will for eat, how for able to eat healthy food, and then we will live healthier. The next person we can get at the panel, Miss Aminata Jallo. In order at the beginning today, but if you don't phone me earlier, he say he will join me. He will join me midway through. He specialism pharmacist, a clinical pharmacist, and he talk to we them regarding medicine. Anything for do medication, who's kind of medication for take, how for take medication, how for look after medication. Now Miss Aminata Jallo can normally talk to we about. Next person we'll get now Miss Aitata Shaka, instead of a mental health nurse and a social worker. Instead we'll talk to we about anything regarding mental health, we'll be able to give you advice, okay, and guidance. Next person we can normally get now Miss Fatmata Kamara. Well, Mrs. Fatmata Kamara when a Dr. Kamara work, but today you know we'll get for day with you, unless maybe towards the end, maybe go join me, but I'll not be getting any signals say good day with me today. And the last person at the list, me, like I said, my name is Timo John Fuller, I'm a business IT consultant. My role not to forgive medical advice. My role now for make sure say I provide the team with all the IT support where they need for the program be successful. We get other people them as well on we can do on the panel or we can present to we like Dr. Aziza Sise when I present to we the last session, but not do it today. Maybe you could join me at some point. We also get Dr. Toure, we can deal with himself now, general practitioner, but not able to now for a while because they get other things the way they do, but he deal within the team still. So at some point we will see him just in case when I see him in the future, we'll not be surprised. So if I'm with them, without further ado, I will let us say no more and Dr. Kamara present today and we'll not begin on later already. So I will hand over the session to Dr. Kamara. Take me through the session. Dear me family, then while they present, I go ask, say, let nobody know unmute himself. I will go for mute everybody. So we allow Dr. Kamara let it present without disruption. When it done, everybody will get chance for ask questions. You can either ace your hand physically by doing this, or within the tool, you get something the way you can able to press, we be able to ace your hand. And if I see you hand up or I see that in the way you hand up, I will come to you and ask. Now, if I don't come to you quick, it don't mean I ignore you. It just means, no, maybe I don't see you. But once I see you, I will come to you for the ask you question.
Okay.
Kamara, if you're ready.
Hello.
Yeah, no. So I'll stop with you. I will stop me on share.
Don't worry, we're just going to simply quit. We're doing a free check for everyone in the area.
For
Simply quit. So we're doing a.
Are you hearing me?
Yes, sir. I hear you.
Right. Okay. Family una do also on a day, whether in the morning, afternoon, evening, or night, perhaps. Una do and thank you for joining this program today. Before we go any further, I think the host, Mr. Fuller, don't mention one of the names that Fatima Kuroma. Do you allow remember them in prayers because you know well in the hospital as we talk. But you know, I just make a mention as well, remember, I mean, with prayers, you know. This topic today, what we talk about, as we know, a topic where we know by for talk about that. You know, when we this alone, we know the mama them, or papa them, or even the family talk about the topic, a taboo topic. But when a taboo topic, now that make it more important because we do people in the suffer to the extent where they say if them be know how to deal with this thing, then clearly it will be less of a burden, less of a problem. And as they can say, a problem shared is a problem halved. So if we talk about something and they know about it, clearly then go deal with them better because you prepare yourself for that. But this menopause, naturally they begin from day one where the mortal man born, especially the woman. What do you make I say mortal man? Because it affect not only the man them, but the woman them as well. We boku no say man self they go through what they call menopause. Boku man no, but the can talk and some can say what? Well, that's it. But clearly, not only that, but clearly it affect the whole family, including the man them and the woman them. So from day one with the person born, na journey the person they pan travel, they go patrol. And that patrol they begin from when them born he turn, begin creep, begin waka. Then before he marry, he turn woman begin pull bobby, begin get the period. And then the period now they lead to development, he turn woman, then get picking them, taking, born, and then from born, you go to the point where he says, you need to see this period again. And of course, you need to take in again, and you need for born again. But of course, this journey, you know, a long journey, not to see where the beginning. So as I say, from day one, where the person born, it work toward this and to the end of it. You know. So, when I don't tell you about that clearly, I don't even understand what you try to talk about today. We get for obviously when we talk about something, we need for know waiting at the meaning of that. If we talk about say menopause, we want to know waiting at the meaning. We want to know how they affect we, waiting at the symptom, then what you go feel, and then of course not only the fact say what you they feel, but we get particular people and particular group them who we go for deal with as well. Then the third one we see that LGBTQIA, like almost the alphabet, but anyway, it mean then we people and we. So Monday na woman, you want on man. So Monday na man, you want on woman, and then they in between them. And that means then if they go through this thing, believe it or not. And then of course, if we talk about that, we need to know what they cause this big I know we call it sick, na phenomenon, you know, na journey. What they cause them? How you go diagnose them? You know, how you go treat them if you don't diagnose them, and of course how you go for help you for make you able for make this journey, this difficulty a lot easier for carry through, and then we go summarize in the end what this thing there about. So as I say no more, the meaning, all my daily menopause. Now, obviously, we need for no say this na stage. Na till they go from one phase to another phase to the next one until they reach the final stage. So not to sickness at all. This na stage work where they happen to everybody. As long as you're born, you get them over here, you get this womb, you must go through this. It's as simple as that. And the meaning, now two words then combine. The mens, na Greek word, the pauses, na Greek word. So when you combine both, mens means month, pan Greek. And then pauses means pause. So when you combine all two, now the cessation, it means the stopping of the monthly period where woman they see. This is nothing where no woman no able to avoid at all. It's unavoidable, just like how other things in our life we can't avoid and like that. You know. But of course, people and they define this thing as the woman them we medically then they go through their last menstrual period. Now that then take as menopause. Now this period can last up to 12 months. You know. So as I say, now this we need for no. I just talk now just now. If you look at the 5 point them, where they point to you, yeah. The first one, between the ages of 40 and 58, every woman, where believe it or not, some woman the way they born, they not get womb. Some man don't know that. And then they not get womb. And some day we born, then they get the womb, but then they not get the ovary them. And without the ovary them, there's no way you go get for born picking. Now it's in that. So between the age of 40 and 58, every woman will get womb and ovary will get for begin experience some changes. So man, you go begin straight away. Some man will begin a bit later. But definitely between 40 and 58, then changes and therefore don't begin happen. You know, and the definition is such that somebody where they go through the menopause, if for at least get 12 missed period them. So, like for example, January to December or December to December, if not the case, if you don't see period for 12 months, then definitely that then consider as menopause. All right. Now, as I say, nothing when they begin 110 no more. Nothing they go small, it come to, you know, in full stop, really. Obviously, number 4, as you see, the symptom then way then they go through, most of them, the common one them, then they sweat too much than that. Sometimes then you go lay down, you go see and they grab, say, the place too hot. Before 5 minutes no more, you put the fan on. Next thing you realize, before 10 minutes, you hot the fan, say it too cold, begin cover with blanket. All that thing then they show you. Sometimes they for sleep, they get difficulty for sleep. They up and down no more. You know, they get them bad dreams and this and that. And of course, you know, interested in Papa again. You know, you not get nothing for do with Papa. Papa go near and say, no problem. They go alapana, you cause problem for them, then go make plaba because the mood they change. And especially so somebody will be say, don't they suffer with anxiety problem already. We will not talk about anxiety. I think Ms. Kamara and Ms. Shaka will not talk about that. But obviously, this even worse when they go through that menopause. You know, the sleep problem, of course, we will not talk about Mr. Sisi, we will not talk to you about sleep problem nightmare. So now even worse when they go through that period, you know. So if any woman, they between the ages of 40, I go talk about the one the way they come earlier, but any age between the age of 40 and 58, if then they experience them problem and they don't know what's in the happen, then they need for talk to the doctor. We go help them, the GP, now enroll that for do for help for then to go through smoother. Now, I just give now a few statistics, you know, for Leone know, you know, the average age, as I say, in medicine or in science or anything we do in life, you get the average when the one the way boku within at the middle, and you get the other way they under, below average, and the other way they above on top, when at the above average. So normally between the age of 51, most of the human then now don't begin go through the change in their life. Definitely. 1 in every 100 women them now the UK will definitely begin experiencing, but then most of them, then the 100 women they talk about, 1 in every 100 can actually experience them a bit early at around 40. But mostly on average, now 51-year-old now in the experience. You know, as you see, 1.5 million women them, you know, now then they experience them on an annual basis. And amongst them, then 80% of them, they must get some symptoms. Now the symptom them boku, you know, up to 34. Some man say even more. But you know, me say now all the symptoms then one woman go get. You go get some more, you go get some less, or you go get 1 or 2. But clearly, you must feel 1 or 2 things there. And as I say, the symptom there, as you see, we don't talk about that. The sweat in the neck, the feel hot and cold, you know, mood swing them, the joint then they add, the muscle then they add. And so woman they can get headache. We one day today not do headache, you know. Then they say nothing will get for 2. The other one, obviously, as we need for know, as I say, usually the menopause can take up to 4 years. So after the last period, it can take up to 4 years for establishing and for carry on to the end. But some people, as I say no more, the way they're above average, 10% of the human, the way they go through the menopause, sometimes their own time, it can last up to 12 years. You know, we hope say nobody not go through that problem for 12 years, you know. But you know, I need to know about that. So as it is, when you talk about the menopause, you must want to know what kind of complication the way you get with the menopause. Now, luckily for women, then because they get this monthly period they go through where they circulate and go like, definitely their own chances of getting problem with their heart and then blood vessel that are open in their body is far less until they get to menopause. When they get to menopause, then they're equal to demanding. Now we demand now we can suffer at an earlier age. But by the time they get to menopause, not equal or even sometimes then they higher than we. Apart from that, you go see say the bone then they broke. So Boku man can then lost balance and then go for them, and if then for them, then can broke the bone. So when they can come to we, if woman at the age of 51, 60 come he broke his hip, clearly I can take and say now menopause the bone in the week. Therefore, sometimes if I say it's not normal for black broke the bone, then clearly I need for begin think about doing a bone density scan for see how the bone then there. And sometimes you could need vitamin D or you could need something for help with the bone then, you know. The other thing making happen is that there is this risk they go up with the possibility of ovarian cancer and sometimes even breast cancer. That now mainly and more so for people in which they use that hormone replacement therapy. So if, for example, you're young and then you begin to experience the menopause, and clearly, you know, hormone they put against nature. So they fight against nature, and therefore nature gets way the fight back. And so then they, if you take them for too long, that make nowadays before then they give you Panam, then go tell you, then go ask you age, and then go ask you how long you go for day Panam, then go tell you all. So that they go avoid, say, although then they give you the hormone for let they help you for the bone them, for the heart, and for the depression, and for the focus, and diabetes, and the sleep disturbances, then go actually say, well, we're going to give you up to maybe at the age of 45 or 50. And then thereafter, we will take you off, because waiting do the risk of breast cancer, ovarian cancer higher. Therefore, we don't want for the help you with this, but then you will cause problem with you sick, you know, give you possibility for get cancer. So clearly, nothing want to go for negotiate with the GP. But as you can see, the sleep disturbances we talk about them, is surprisingly, women the way been done, they take in the picking them big for the size, then develop diabetes when they get Bεttεh way than they expect the baby. At some point in, you know, at that menopause days, sometimes the diabetes can come back. So that's very important for keep an eye on and see how the sugar they creep up. You know, again, depression, you know, because this thing that way you picking and don't laugh, humans sometimes the one that say, I go born again and everybody get this, that thing, so can get them more depressed, you know, and get more anxious. And then of course, if you've been the focus for maybe 1-2 hours, you find out, say, you need to focus again for that time, because before you matter, the brain no as active again, it begin get confused, then clearly enough for begin think about identity. So we just talk about then here, you know, the complication that we see. Osteoporosis, not to do with the bone depth, as I said, they're weaker. Therefore, you go need vitamin D, and you go probably go directly for eat a calcium rich, you know, diet. The food that they rich in calcium, like yogurt, you know, then the leaf the wood they eat, all anything they need and good for that. Failing that, they will give a supplement for help you for protect the bone. Again, the heart condition them, you know, the estrogen, that are the two hormones, that the estrogen and progesterone, and then two down the way woman they produce, whereas the man and they produce testosterone, you know. So when they begin go down, obviously, you will get more possibility for get heart trouble or problem, you know. And then of course, we don't talk about breast cancer. Not to say the breast cancer nine they cause, and not to say the menopause nine they cause the breast cancer. I want to understand that, you know. But the hormonal changes where they take place because of the menopause, now in they increase the risk of a breast cancer. I repeat, the menopause not they cause breast cancer, but the hormonal changes, the changes of the hormone where they go down, the estrogen and progesterone, now then they increase the risk for the possibility of breast cancer. Right? As I talk about, this is a journey, a transition. You know, they come out from one level, go to the other level. You know, so man, so woman can take and say, this one they don't know. I'm not going to go through that monthly period. You are going to say, the back they at me, the mood they change, me belly they at me. You know, they bleed beaucoup or they bleed less. You know, or sometimes they afraid say, I'm going to begin to take belly or this and that. Well, so man can take and say, now time for liberation. So man now, obviously, could take and say, you know, begin get depressed, because what you do by then they begin on big, then they begin left home. That's what they call empty nest syndrome. It's very important for look after. So if mama they go through it and the papa self understand, picking themselves understand, well clearly then go deal with them better, and the experience will be less challenging and less problematic for everybody in the family. But as we know, it begin between the ages of 40 and 58, you know, and the average now 51. But it can happen before time, when we call either early menopause or premature menopause. We could talk about that as we go on. But then, if you look at the causes, well, then get two. One way we say they happen naturally, we'll just talk about, you know, and then of course the one way they happen because of intervention, where something happens. So Monday he needs surgery because we didn't do something, and find out say he get abnormal cells. Then when they do that. When they do the smear test, they find out they get abnormal test, then they begin saying that for do surgery if they need for save the person so that I not going to develop cancer. So then go pull the womb then. And if they pull the womb, so most of the time then go left the ovary then, because every night they make you get this cycle, this estrogen and progesterone, and they egg them. So if they pull all of that, then pull the womb together with the ovary them, then clearly this menopause go begin a lot earlier, a lot sooner. I don't see somebody who at the age of 27, he be not born 2 picking that day. If you really want for born more picking, but because of the problem we they go through, the bleeding be so bad, they don't try everything for make this thing better outside. So in the end, before you can become anemic, you can become passing weight until you get heart problem, heart failure and all that. Then they say, well, you don't born, you picking them. So we need for just do one thing and for try to get this over. And in the end, then pull the ovaries, they pull the womb, they left the ovaries them. So when you okay, but then the other one, he now end up lose everything. So in the end, they get for give hormone replacement therapy. You see? But of course, this one I then call early menopause because we didn't do something they cause that. Well, these other women why they talk about we actually you them pull the ovary and the womb them, they actually give them the option, say before we take them, so until you go unborn, they say yes, but if you not get womb, you not get ovary, how you go born? And they say, well, okay, the option we will get, we will give you a chance to make you egg them from the ovary and freeze them so that you go either use surrogacy, where somebody say go rent you in womb, where then go use your own egg them with the man who you get for married for let them try and get picking for you, or that's it. Then go make the picking them, then take the man where you got married in your own discharge and you the woman egg, then put together, then make the picking begin for grow, then go, then put up and deposit away in womb with the rent, with then call surrogacy, And apart from that, then you actually use that maybe to your fumble. We go for you womb where you will forget you egg when night. You don't pick in sex yourself, So then they get benefits and then get this, then they get balances there because they're expensive thing. So not all my for do. But the natural one, we don't talk that already. Say 9 days. So as I say no more, now the stages then why what we talk about. We get perimenopause, we get menopause in self, and we get postmenopause. Now peri, now the one way, now the year then we surround. Like for example, by the time you did 35, 38, 39, now the peri one, then by the time you get to 40 and 45 to 50, that's in the menopause itself, then the intramenopause, and then the post-menopause now after the whole thing done established. As you can see no more, the perimenopause can last, up to 6 years or even longer, and the menopause itself, obviously, can last, as we know, for up to 12 years, but generally by 8 years, if it don't be okay. So 12 straight months where the person woman not seeing period, they're definitely there in the menopause. As you see, perimenopause can happen usually around the 40s, so around them 45, 46, the woman would don't begin say, the period not the flow, like I mean the flow, don't they last, don't they light and all that, and then continue. So definitely the estrogen level, then don't they dip slowly but surely, gradually, and then go up and then countdown, go up and countdown. So the period then not regular again. So you will begin to see that, by the time you get to the 50, and get to 51, 52 clearly, then don't drop significantly to the extent now, they see again. But if you don't do 12 straight months, 12 months continuously, you don't see a period, then clearly take and say now, you in at the menopause. And then of course, when that don't begin now, don't happen, the postmenopause don't happen. Clearly, then will begin drop a lot faster until you get to the point where you say, now that you take and say yes, now so it don't be for you. So that's it. So perimenopause, menopause, and postmenopause. Now, I want for advice with sister them, we auntie them, we mama them. If this menopause don't happen already, like I would put on, so at the age of 50, 52, up to 58, sometimes up to 60, if the woman begins see period again, not a good sign. So postmenopausal bleeding, not a dangerous sign. So if anybody they go through and please, and pretty please, contact the GP or make them begin check you straight away. They go send you to gynecologist, then go check you, assess you, and find out why this will happen. Because once you don't stop, you need to come back again. But then we just mentioned that's what they call premature menopause. Now, obviously, as I say, it can happen to any woman, but we in particular, the Afro-Caribbean people, them now we prone to this. I get one my colleague where we did look into this thing to find out why it is that we as African people, we get this subfertility where we need to take Bella easily. And of course, by the time you get to 35, 40, you will begin left for C period. Why is that? Which make we other one them, the counterpart them, the which one them. Then they're able to see that carry on. Why is that? And I think we're very interested in and they do research on that now. So anybody with the experience then can change here, before the age of 45, Juya, I beg una for see the doctor then, for make them able for assess una, and sometimes Nati will then go look at, they know say this one, Nati will get for do for you quick when, early enough, catch them, assess them, analyze them, and then obviously treat them where go forget you wish when you want for let you able for taking and born picking, because every woman in this world one for born picking and one for carry on, for let them call her mama. If that happened, if for call mama, then obviously to your place and not taboo, then go begin you all kind of name and that not to be nice at all, because clearly it cause problems with the psyche, the psychology, and the human in feeling and all that. Now making important if that TV there for reverse, TV there for cage, and they're able for happy with them, then go do that, and the sooner they get them, the better it is for you. But you see, so the reason that they will go make some woman stop for get in period on a monthly basis, as I say, if it happened before 45 or 40, then clearly in premature menopause that. So until then we can cause them. Now, all man can go surprised, but tuberculosis, TB, nothing we can cause that. Malaria, now other one, nothing we can cause that. So chronic malaria can cause problem with menstruation, we can cause the human, no for born. So where will people learn for look at what to make we people learn, so then the human they know for taking all the things until now they overlook. Until you go don't get some bad malaria. Or until you get TB where they don't know about. Not to just the chest. The TB they affect other side them all. They affect the gut them. It affect the belly, and it affects the blood itself. So a lot of things can happen by then that you see. And of course we get this thing called Turner syndrome. That's not the chromosome the way the baby they grow, then the self can cause that in there. Apart from that, then get this thing called autoimmune illness. Now, autoimmune means your body where you get the effect against you. So you get your body, all the parts the way you get, they all belong to them. But some parts there where they say, you not belong to this body, me and you will not get company. But then the body they say, no, we'll get company. So that effect there can cause one thing or the other. We go make to the point where we say the human they're not for conceive and very early in their life, maybe at the age of 30. One example now lupus. Lupus can cause that kind of thing, So clearly, TB, now other autoimmune as well, that can cause that. And of course, mumps. Now mumps, Bokuman fi say, now man no more it affect. Well, the human itself it affect them because boy picking if you get mumps, and for try for clear as quickly as possible because it can cause subfertility where the picking, the bubble, for produce enough sperm for able to get woman for get pregnant. So these are all things we need to know about. The other thing that we can cause that obviously if they don't see you get abnormal cells there, na the private part, na the womb, then clearly they will get for do either they do operation with then support and then top them up with chemotherapy or radiotherapy. Now, obviously, if they give radiotherapy, clearly radiotherapy they send X-ray treatment to that area, and that area then I did the womb day, and I did the tube then day, and I did the ovary then day, and I did the egg then day. So clearly, it will kill them, and that can cause that menopause. The difference between the menopause where they happen naturally and the one where they happen because of sickness. Now, the fact say the one for the sickness they happen straight away. The moment you do the treatment, you're able to administer the treatment, and that's when you go begin to see the difference. But of course, when the natural one they happen gradually. They happen slowly but surely. You see, as I say, I've been talking about the fact say. If you actually go through chemotherapy and radiotherapy and you still able to produce the egg, then they can actually, as I say, we talk about the egg, then where them go freeze, and then later on you go forget picking out of that. But of course, you get to go through counseling and therefore go to the risks them, and of course the possibility of heart disease and osteoporosis. So here you go. We don't talk about perimenopause. Now the symptoms then there are, you see, the hot flushes. Again, we talk about that. The problem for sleep, and the bleeding. Then they light, then they heavy. Some man can get clot to the extent they become anemic. If they turn, feel light, feel lightheaded, feel dizzy. Yeah, they turn and hit the turn, and then the heart begin beat fast. The heart they cut and all that. And then of course the problem with anxiety, irritability. Before you marry no more, small thing no more you don't vex. Still wait until you not be in the vex man. Don't begin vex. Pata picking, nakaya, cause and go under this and that. And it happened again to the man, cause him this, that, deny him this, all then thing they, if they around that age, between 35 to 40, he need for begin think about that. And if the man self knows saying that they happen, And the picking themselves know, clearly it will make it easier for cope and for take this thing through, because as I say, not to seek a journey. You know, the brain again, the concentration can become less and less. So if you don't begin at the age of 35 to 40, do ya, let we able for beer. Then we mama them, we auntie them, we, you know, we cousin them, and we sister them. We then they go through this thing. But the important for me to know, because if we don't know, we don't know how to deal with them, and that creates the problem. But now that when I don't do the bottom, sometimes we go help one person, we go forget for understand how this thing work, and then take it from there. We don't talk about the perimenopause, now we talk about the menopause there. As you can see no more, as when I see the symptom them and the changes them, look at the picture. You will see, my way sometimes not be they get headache. I don't say they all been they get migraine, or you get tension, headache, or get cluster headache, or get headache because of blood pressure. But if a day come from nowhere, then begin come regularly at the age of 35, 40, 45, then clearly that's something a part of that. Look at this. So man don't even know about that. Say the gum then they recede, the gum then they get less, you know, how you call them, poignant. We look at them, they're not they don't for they look at them in day, then they go down where they cause the teeth will begin show worse than I've been there naturally, and then they cause bleeding. So part of that, now part of the aging process, now part of the menopause. So one day the bobby can get less, the bobby can go down rather than a day up. Which sometimes been the cacks 10, 15 years ago. Now you don't notice the baby don't begin go down, and of course the nipple them then can painful, you know. The bone them then can weak because of that. If them fall down, then can broke them bone nasty one compared to how if them in the young age you know go survive. Again, then I mean when they get them big picking them, like for example 10-pound baby, 8-pound baby. Sometimes we mama them they born 6, 7, 8, 10, and the labor maybe a bit delayed because they for dilate in time. They can end up cause problems with the bladder, so that the extent then get this to them called stress incontinence, where before the thing can no more where you feel for go toilet before you might ride in get accident. All the things that because of the fact say the body they go through that change. So then they then can give you other treatment will go help you for that thing. If they don't notice them beforehand, they can treat you. You know, again, the place, the womb where the baby they lay down, in they get shorter. And because of that, the cycle then they get longer, you know, and of course the private area then they dry, they can cause problems where the skin they break and then you get thrush, you get itching, they crash like that. The more you crash and the more you break down, I know the possibility say you will get infection. You know, the skin they dry, you know, we can make if you won't say for lay well, they take a lot longer than if you've been there in your young years. Again, we don't talk about catarrh. This palpitation, they had the beat fast. Then they all are part of the symptoms. And the big one, they can say in a man no more and they get bullied. Well, the human themselves, when they go through the menopause, they can lose the hair. The hair, the thin, and it can become a bit of a problem where some women can get depressed because of that. You know, the night sweat them, and of course, one main problem where they can get now this weight gain. Then love handles where it can come and say middle age or crisis or whatever. And then they all can happen, and then they can make them depressed. They begin feel bad about themselves, saying they don't feel attractive again to the power or the, you know, and you wonder where they're around them. So clearly, and they help, and the business of mood swings them, the anxiety, you know, all the things they help. So they all the things they intertwine and make it fine for making nobody's thing and know how we go for handle them. You know, again, as you see no more, it affects the mood, it affects the hair, it affects the bobby, the breast, it affects the heart, it affects the bladder, it affects the bone, and of course it affects the womb, and of course the skin. As we see no more, we don't talk about that, you know. We get 34 symptoms we have been telling them first at the beginning. I'm not going to go through them, but if anybody interested for read about them, then they slide them bottom. When I go see them, you know, we'll go for send them, and with the recording, they go on when I go see the slide clearly. But as you can see, we don't know most of them, you know. I don't think we need to go through them, but you can see hot flushes, night sweats, you know, the period them not be the same like them in day, you know, they flow again regularly. So you go see one today, you know, see one for another 2-3 minutes. And then of course you get the mood swing them. JJ no more nine that you don't vex continuous until you not be vex. The dryness, you know, down below the private area. And of course the fact that you're not interested in, you know, papa and, you know, and uncle and grandpa, clearly then they can cause problems. Headaches, anxiety, sleep problem, you know, the loss of the hair, the memory, no day the same, you know, sharp as like I've been there, you know, for concentrate don't become a problem. And of course, the weight gain, weight naim, bokuman, they worry about. Then of course, because you lose the blood, you get that dizzy spells and you can get tired easily. You know, the bobby I don't talk about them. It can become painful. The joint them. You can get bloatedness. You know, you can get bloating. So man can face some term now intolerance to wheat or maybe bread. But this can be a sign of the fact that menopause don't come. You know, that bet na the hand tingling, within at the hand at the foot, it can happen. The skin, they become itchy, you know, they scratch, you know. And of course, one thing where necessary not be know, now the fact say the body odor, they change again because of the estrogen. Now, if mama begin get an older way papa not used to, and clearly you need to understand, say, at this age, where it is until at the age of 45, clearly important for, you know, say you need for support and this. Again, when that incontinence comes, that accident the way they happen, sometimes the human, they feel say, oh boy, the urine will begin cause problem for a man and all that. Then they all, they lead to the stress, they increase the stress, and the stress, they lead to one thing, and then the mood, they change from one thing to another. So most of the times on man can they need small dose or just a mild dose of antidepressant for help them for go through, you know, and then of course they can develop allergies to a lot of things. Then when they not be no say they get allergy to because the menopause don't reach, you know. So as we don't talk about all of this, you know, if you've been taking, you know, once every month or once every 6 months, now you don't go a bit further. Definitely menstruation no regular again. The fertility, the chances of actually taking in and conceiving less than I've been there maybe 10 years earlier, you know. And of course, the buildup of the fat around the belly, you know, now that they can cause problem as well. We now can make some women them prone to breast cancer, ovarian cancer, blood pressure, diabetes, all that in there, you know. So now we don't talk about the people and we know say now we own general day-to-day people, but there were a special group of people that now the one day way they say then body, then visit then trap. Either a man he trap inside woman body or woman trap inside man body. So then can one go say then one go from one extreme to another extreme, where then go the woman day he gets in ovaries them and everything, he go get operation for make them gear man private part, but then they left the ovary. Now that kind of woman they clearly he could begin get the same problem that if they take the ovary out for letting not get the symptom, he could get the menopause just like how he been there as a woman. You know, same applies to the man. Instead of them begin getting you know, estrogen and just you know and progesterone, instead go begin feel the same thing. I get to the point where they say if you're supposed to go through the menopause, clearly and that you go through as well. But it's important for me we know say we need for be tolerant, we need for understanding people there, you know, and for help them as best as possible, you know. And that's the essence of actually mentioning this for Leone. I know say people like that they exist, and we all know we way they do them work here. We know say when they come across them, you know, every day almost, you know, they come across them. You know, last week I get 12-year-old Bobo we say one become a woman, you know, and that kind of thing can happen. So we just need to deal with that because this is the life, this is how it is, and we not get anywhere for go. When you get this the change, clearly you need to get treatment, and the treatment obviously they vary. But one point them way very very important now the hormone, you know, that estrogen and progesterone, you know, where nine they go down to the extent where they say no go for make you get for begin taking or for begin produce the egg for that you, so that you go for born picking or you know take picking in, because if you progesterone level no day up to 40. You're not going to get pregnant. So then get for actually enhance that. Now, if you imagine, say, you don't get premature menopause or maybe early menopause, or they take the ovaries them away, then take the womb away, and now you're at the point where they say you don't begin suffer with the signs and symptoms, clearly then go help you with that. One of the ways for help you now for give this HRT, the hormone supplement them. Then get different one there. They can give you the cream where you go rub, they can give you the patches that we go put in your body, where you go to change maybe once a week. You see? But you get to remember, say, I think the GP will actually take you through that because any GP where they give you their medication, yeah, where they start you on their medication, yeah, will actually go through the contraindications and the risk factor there. Now, if you get family member, we get heart problem, we be not get clot them, you know, clot them at the lung or clot them at the foot and the leg, then, or maybe you get high cholesterol, then clearly that person they need and then you get forget possibly if you know say the family member get liver problem and then if you don't get a stroke or if you don't get cancer, of the breast, then clearly you can't be taking them patches there and then topical cream. The other treatment they can give the ring them, they call them then ring for pessary rings where they put up the private pattern for the human for help with the dryness and the itching and the cracking of the skin. You know, you can go over the counter, you meet any pharmacist, you go actually suggest some gel them and some product that will go help with the dryness, you know. And then of course they can give the low dose contraceptive pill for help you with the hot flush there, you know, and again for change the mood and of course the dryness. Then of course, this is the big one. The low dose antidepressant, very important, not only to people in way get depression, but to people in way as well not get them. Because at the end of the day, you get to the point where sometimes you probably might need them. And what you want to do, now try for catch them in time before you actually take control of you. You know, as you can see no more, we don't talk about all entire hormone therapy, the lubricants and way for give, and way for rub down below and the body, the patches there. And of course, the antidepressant them. And if you smoke, this is big. If you smoke, you need for cut down on the smoking and if possible, completely stop the smoking. That is very important because in the help at all for this thing. And of course, some lifestyle changes them where you need for take on board. So amongst the lifestyle changes, yeah, you can see regular exercise. You don't necessarily mean say, pass you go begin, you know, go to a gym every day, this and that. No, you can just walk around the block. It's fine. Learn for relax. Take then deep breathing exercises. It will help you, you know, very much. And the diet, obviously, plenty of fruits, vegetables, whole grains, then they help. As I say, stop the smoking. And if you drink, we'll try and avoid or limit the amount of alcohol we take. As we know, Ms. Jallo did not talk about this thing before. You know, the amount of alcohol we're allowed. For women, them, I think that 14 units. If you can reduce them, that's even better. For man, them, I think that 21 units. If you reduce them, that's even better. You definitely can get counseling, you know, if you go through anxiety, the changes, and of course you get problems with the man or the boyfriend, or as they say, or the husband or whoever. But clearly, if you go through that problem there, or the girlfriend for that matter, you know, then of course you need for actually seek counseling. You know, try for able to get some sleep. Of course, the thing that they will go for help you for let you sleep better. You know, and of course rest as much as you can. Now, because of the incontinence, that accident can happen way before you feel for go past water no more than that. You begin wet yourself and all that. Then get exercise they will can prescribe for you. We go up for strengthening the muscle and they will at the pelvic floor. You know, then they say quite good. Then call them Kegel exercises. You know, one other thing we know they do is that we need to talk to, we party them, we need to talk to, we people them, we family them. We don't go through this thing. Then get a lot for teach we and we get a lot for actually learn from them. They can actually help you for make this transition, this journey really a lot less burdensome, a lot less problematic, you know. And of course, this one naturally can cause problem at us, you know. Mama no want, papa want, and then it bring friction, it bring confusion to the extent where they say, we know say some man can divorce for that. So then some papa them can get pushed for go begin keep them small picking them and this and that. We themselves, the heart not there that good, the blood pressure don't they up, you don't know, the diabetes don't they, you don't know, and all that. Before you marry, they say stroke. Before you marry, they say heart attack. So it's very important for make we get ways and means for try for address this problem, so that at least the process, the pleasure way people they get between the man and woman, it can still continue with a bit of adjustment. No questions about that. If you're able, maybe volunteer in a hospital or in any other gathering. You know, join a club, wait until you go to learn book or go play bridge or whatever, you know, and of course get a new hobby, you know, something where you know been able to do, but you know, do them. And then they go help you. So until you able for write, put your memoirs, put your feelings down and all that. Never know. So until you go for print them or publish them, that might be a good thing for you. No questions about that. As I say, look at the food stuff there. The hand way on top, and then they will kill for eat, where they advise you for eat more. And the one the way they don't, and the way they advise you for trying to avoid. As you can see, we will like McDonald's, then fast food and all that, then deep fried food, then you know, refined grains and all that thing. Then they try for eat less of them. You know, if you go through this period, try for eat more of the sweet potatoes, the nuts, them green tea, vegetable fruits, you know, fish, yeah, turmeric, dark chocolate, you know, extra virgin olive oil. You know, the herbs them, and then of course garlic and ginger, you know. So in summary, all man for no say this thing that thing where every woman, as long as you get womb, you get ovary, you get for go through this journey, you get for go through this transition, definitely. So the changes in the relationship, na work and the home and all that, picking them then go, that emptiness syndrome can get a significant effect on the person, on the woman. This is not a problem for just the woman, no more, a problem for the whole family, including picking them and papa. You know, it's very important for make we all gel together, make we get this thing going to the extent where we say the woman we are indirectly involved, he actually need to face the problem where he could face, it could make them a lot easier for carry through than for letting one green face and they go through depression and then one thing lead to another, you know. But as I say, Bokuma then don't go through this, or man don't live in the 80s and the 90s, they live a very fulfilling life after this you call them transition, this interval, you know. And so at this point, I thank you very much for listening to me. And as I say, this is not the one that way, if you want to read them in detail, then they are, you know. But thank you so much. And I go allow now for Meku and able for them decide whose question they want to ask, and me will be happy for, you know, answer them as best I can. Thank you so much.
Thank you very, very much, Dr. Kamar. Thank you very much. That'll be a good session. I see all my face quiet. I wonder what people really think. Thank you very much for attending, and I thank you on all done patient. Now, at the time we go open the floor for let people ask questions. By the way, I see how people in concentration. I mean, they watch people in their facial expression. You know, that's serious. Everybody think. And they look forward now to the questions. What are they go first? Before, hey, yes, Brother Karim, how are you, sir? There you go. I don't unmute you, sir. Try for unmute yourself. Press unmute if we're able to allow you for unmute.
Yeah, okay.
There you go.
Thank you very much. Thanks for this enlightening, you know, presentation, Dr. Kamar. It's always beautiful for listening to you. Where they broke things down for we level understand them. Whoa, no sabi. Like me, afraid medical terminologies and bad one. I get well. You don't quietly help me, Mr. The gentleman that I talked to now about the last one, the last presentation, when about diabetes.
Yeah, I will put the link.
Yeah, now we've been pray for so many of us we want for country about things can happen, we'll get some burial so that things prevent you from I'm having to ask for people repeat that. But anyway, since you go on YouTube, then go fine.
Yes.
And we're keeping along the one, there's a myth around say man can get menopause. I don't know if that's just myth or not way factual. Now I just want to let Dr. Kamar throw light on. And two, now depressants, you talk about antidepressants. We as Black people are very, 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 you know, suspicious of depressants, tablets and like down, and they would feel say, now way down the way, in fact, would even feel to say a ploy for let some people way not like Black man, just make let increase. Let me then they get the antidepressant then they. So I want to let you tell you small about that because it's important. You don't mention them but twice for sure it go help. And the food side, unfortunately I don't see this, I don't the slide and don't go. But the food side, on some food then they were some man they feel to say they even cause more problem for them than it will help them. Like for example, yeah, some food then where they're not only allergic to not all food the way we talk about allergies, but now food and the way they create some discomfort and then can always mention. So how person will be able to supplement them food and then a nutritionist will have advice for them to talk to, or now just now your personal research you will go about because you're going to hospital and thing they tell you. And I don't know what I get for you for now, sir.
Okay, Dr. Kamar, I don't know if you catch all the question. And the first one is whether menopause affect man them. The second one about antidepressants, you know, waiting at the effectiveness of them because there's a myth within the Black community say if you see them give, they begin giving and do something cynical to we. And the third one, sorry, what's the third one again? Oh, about foods, the diet, we diet is stuff, basically, and which now your advice on that. Sorry, sir, we need you. That guy for YouTuber. So now the three questions are in the Uncle Doctor. So if you can help with what
now the African perspective, more like people waiting aside the way they will get some of them food and they will call them very costly. Now food and none in the way sometimes food and the way Africa will fumble them with it.
Yeah.
Because at the end of the day, we in a very small number now, and could call minorities. But we have them boku and food scarcity. How possible we able square balance that one? Then I ask.
Oh yeah. If you go on the YouTube channel, you will meet we one party program. I think 2 or 3 programs will be done do on diet. You go the way Fatima and I been doing. We break and down. You give you advice on the type of foods that we'll go able to eat. How we able to eat a balanced diet based on we own food them we don't normally used to. But Uncle Doctor will give you an overview. But if you want like an in-depth information, I will share the link in a bit before we finish. I will share them. So you go able to go on YouTube and see all the other sessions that will be done do before.
Thank you.
So Uncle Doctor,
information I give people them, briefly. Although now I'm glad the way they're on YouTube. Some of them here what they get from Dr. Kamara. Sometimes they also they pass it on to some of the young people the way they ask you, they feel so we will know better. But that make Lego be able to small number for them. Sometimes they don't foolish question what they ask a big.
It's okay, no question on the foolish, I'm sure. Go ahead, Uncle.
Thank you so much, Brother Dabo. I'm so grateful for your comments there, and really thank you for joining us. You are one of them. They regularly join we, and we grateful for your support and the enthusiasm way they show. Now, the first bit where you talk about the male menopause, so man, no, in fact, one slide the way I don't be just one confused the matter, but I think we for put them up. Maybe you don't hear the phrase andropause. Sometimes you don't hear that shit. Andropause. That's not the male menopause. Believe you me, the symptoms that we women they go through very similar to the one that way the man they go through. But for the fact say the libido, I don't know if that makes sense to you. The libido in the man when they go through the andropause or the menopause or whatever you want to call them, is far enhanced, really high, to the point where we say this man all 10 want this thing, all 10 want this thing, and unfortunately the body now they say, "But the blow you get for reversal, take a reversal." You know what I mean? Yeah. So the body in adaptability and the head or mind in desire, they're not there in sync. I don't know if you follow me. I don't want to be very crude, but but I want you to see which side they go. The supply, that's it. I don't use economic term, although being a doctor. The supply and the demand, they're not equal. And so we think for happen here, which how you they get the supply with the demand there, the supply, they come. So the next thing you realize, the demand does they go higher and higher. And because the supply no there for meet up with you the demand, then the man begin to go buy cookery outside. If you know what I mean, the drift. I see the laugh. I can make joke, Now this way they go outside for go get this, cookery. Where the cookery, the person way they cook the cookery, if you been they put one creature for you, and then a 5 you go put. You now want make chief bumper life. Yeah? That is where the problem arises. I don't know if I'm making sense.
100%.
Absolutely.
I don't follow.
That is where the problem
and I'm
arises.
sure Mr. Dabo they follow. We see they laugh, so they follow.
Exactly. So the next thing you realize, that too, chest pain. The next thing you realize, that blood pressure picking up. Next thing you realize, heart attack. So stroke. All the things we really important for me to look at. But if the supply and the demand actually get one way for each, even if not 100%, but maybe up to 50, 60, 70%, with the aid of some other thing. For example, if you take the antidepressant, the human take the antidepressant, it will take up to 6 weeks. So when you begin to take the antidepressant, not to say they work straight away. Miss Kamara will tell you about this. It take up to 6 weeks to make it kick in. Then you begin to feel the effect. So imagine, if this thing don't kick in 6 weeks, clearly, so then that cookery will be in the enjoy outside, you're not going to enjoy again because what you do, now you don't begin eat fine now. You see what I mean? So that helps you. It balances it out. At the same time, the woman get more faith by you. At the same time, the family, they gel together. The unit to gel together. This is not just psychologically, I just to tell you to make you see how things they work out. If anybody tell you, say, the antidepressant and they give them because they want for do something to me, well, clearly, I can guarantee you, I get 10 colleagues them, 10 people they work with. Out of them, 6 na senior doctor them, they're all day on antidepressant. and not to black man them. Yeah? So now common thing that I can guarantee you. So let anybody, just like how they did earlier on this morning, until you say, now South Africa, all the black man, they say, this now with Mexico, you know they catch black man. It's still they carry on. And now they go on to a second wave. It is amazing how, you know, they actually be beyond Punisher. You know, it's important for, I tell you what, this is the way they make. It's clear. This is a real problem. You check this out. Andropause. It is so poorly understood. There's a paucity of the knowledge to the extent Bokuman, if they know what you do. I mean, people, almost Papa they would talk to people, don't you? They're not there. Remember themselves. That's not taboo subject. So therefore, they suffer in silence, and then the next thing you realize, one thing leads to another. I tell you what, suicide very high at this particular point. That way, I tell you, the people, mental health people, and will tell you about that. It's so high. But if you understand what they deal with, clearly a different story. And something, all it takes something for adjust the food, you know, adjust the environment. Take one or two things then for help, you know, for let the dryness get better, you know, the itching get better. You know what I mean? And of course, you know, you cope better. You know, maybe take another hobby. It cope better. Absolutely, you do things in a better way where you just go enjoy and say, I tell you what, why on earth this woman don't give me all in life? 20 years, 30 years, I don't find picking them for me. Then pick it left. Now when me and you for enjoy yourself, no. Because of waiting nature they do to them, I've actually left and go. You know, it doesn't work like that. But clearly, if you know about this thing, you see, say, then don't they happen, you notice them from the human way, completely different from the human even sabi. Clearly, you self can take a lead as the man who help this woman for go through this transition as smoothly as possible. And with that support, I tell you what, it will be grateful to you and it will actually respect you more and like you more because it knows say you're not sure now at in time of need.
Thank you very much, Doctor.
With the food, clearly, if you're there Africa, there's a lot more you can supplement. The vitamin D, what we talk about, then get in Africa. We not get. Yeah, we get 11 months of rain and snow and whatever. You know what I mean? Yeah, 1 month we get sunshine, you know? Yeah, that then get them. The food the way they eat are completely different. They reach in all the things what they talk about. We did there. They leave them. You know what I mean? All the things then they, you know, the canned fish the way they eat and all that. I mean, how much my able to afford beef? So money they cry for make the person die like go eat beef 1 time in 6 months. You know what I mean? So the fish get your role for play and all that today. And it's important for me to remember that. You know what I mean? I don't know if I don't answer your question, but I'm happy for taking this out of here. All right.
Thank you very much, Uncle Doctor. For my friends, them way when I can say una strong past me, so they una older past me, so maybe I don't be reached aside. I don't call name. Somebody they when in your name na just iPhone. Now you first be doing easy auntie where the vest I will come to you in the BTC honor 8X. I will come to you necessarily. I'll come to you later. You're not part of the panel. I'll come to you in a bit. But I don't know what you on. iPhone. You're not getting
yes.
Let me put you on up.
Yes.
I don't try for you to. There you go. Yes.
Yes. My name is Hamida. I call from the US. My question is, I joined right probably in the middle of the whole conversation, but I believe Doc they talk about between ages earlier than, you know, the early stages of the menopause, and he say up to at least 40, 45, then a pre-menopause or early menopause. And then, so my question is, so actually the real menopause, well, waiting they expect for start at 45, probably 45, 46. I just want to know that, like the age where medically the menopause they start. And then secondly, the second question is, during, what if you don't want to take their hormone pills, because would they say during their hormone pills, then they, you know, for stabilize your hormones or bring them back to some way, can get side effects. So what if you don't want to take them pills then they for the hormones? What's not the other alternative where you go take?
Thank you,
question. Thank you.
Yes, Uncle. No, I hear you, Uncle. Go try for mute. There you
go. I just don't do it now. Right. Thank you so much. Yeah. Thank you, sister, for joining me, you know, from the US. We're really grateful for that. Now, obviously, as I talk, I don't know if you can see the slide. you know, it don't mean say now all man they take the estrogen and progesterone supplement, not to all man. So man they can cope without them, you know. But the one that we need them, then we'll definitely get for go through the risks versus the benefits. You get for sit down there definitely. I always tell people, if you know take part in this assessment, then clearly you don't do yourself any favor. As I put a number, if you get a family history of stroke, cancer, breast cancer, ovarian cancer, yeah, then in the day, clearly, then get for tell you about, then say this one, the risk they go up, blood clot and all that, you know, pulmonary embolism, all that in the day. Then get for tell you say, if you get family member, we do not get them cancer care, well, you they at higher risk. Therefore, the GP or the primary physician, you know, we will not get in America, you know, he will definitely be in a better position for actually give you the alternatives there. So the moment you tell and say, wait till my mama did not get this, or my papa did not get this, and I take note, say there were they from this risk category, therefore, what you would suggest? I'm sure they get ways and means of dealing with this. There's no questions about that. They get a lot of counseling. They will talk to you about diets. The dietitian will come in. The simple, you know, patches them where you go use, we go help you with that. You know what I mean? If you don't want to take them, clearly nobody no go force you for take that. That is guaranteed. There's no way anybody go for do for what you say for take this thing without your consent. Impossible. If I were people in the country in the hospital, I always tell them, say before I go forward, I get 4 options for you. The 2 might not be possible, but I need to tell you legally saying 4 options. One option we now we talk about is do nothing at all. Now you know you get your body. If you now of sane mind, you get capacity for make that decision there. There's no way anybody, any doctor, they in that position for force that in the clearly not. But there are alternatives where if you talk to your primary physician, they could tell you. And as I say, the age of the menopause, as it were, we get perimenopause, we get intramenopause, and we get postmenopause. Perimenopause, obviously, in the 40s, yeah? It can happen a bit earlier, you know, but you're at the age of 38, late 30s to early 40s, perimenopause. By 40 to 52, clearly menopause will not be setting. You know, it can take up to 4 years, as I say. Some money can take up to 12 years. So you need to be really sort of attentive to your body. You can begin to the changes. Nobody going to do yourself for yourself. Okay. The fact that say the period that we've been get on a monthly basis begin go for 2-3 months, you don't get one. Yeah. Or sometimes you've been to go 7 days where you get the period. Now all of a sudden you go for 2 days. At the age of 35, 38, you begin for things say, hang on, no, I don't get this close. You know what I mean? So clearly, by the time you hit 40, there's no 2 ways about it. This thing for don't begin up. You know, but one thing I can tell you is that anybody will get menopause too early or get menopause too late, clearly the people are there at a higher risk. I don't know if that makes sense.
Yes, definitely.
I don't know if that answers your question, sister.
Uncle Doctor, I get another question now for you. Yes, so we can see you. Don't worry, they come. Don't worry, they come. The question is, if woman don't reach that phase day, then can still get pregnant? And if they get pregnant, how common is that?
Superb, beautiful question. Thank you so much for that question. I've been waiting when that question is to come. There's a big danger. You see, if the woman don't do sometimes the last speaking, you don't born picking don't hold 10, 15, and then the period then don't begin go a bit wonky, as I can say, up and down. Yeah. So say you see and this month, next month you don't see her. Next month after you see a light. Therein lies the danger because now it become complacent. Say, I tell you what, there's no chance for me to get better. That is when then bad thing can happen. Like the ectopic then can happen. You understand? Then can miscarry and they can end up really with complications because literally the picking that's the chromosomal defect that we then can get. They can born with a different thing that, you know, where they can say na double, na this, na that, or na denting in the happen. That make you see then say by the age of 30 going down, clearly there's an increase in the percentage of Down syndrome. You understand? As you go higher. So these are the things. And so clearly the possibility they distinctly say this woman can take Bẹ̀lẹ̀, no. I don't know where I didn't know hospital then come and say this woman in Bẹ̀lẹ̀ they are. Just can't check and for see because we want to do X-ray of the Bẹ̀lẹ̀. Where I go feel the Bẹ̀lẹ̀, if you see the baby, 7-month-old baby. The baby now, this is a 50-year-old woman. Now they tell me say the doctor will go meet her and tell me say la left for each babe. Is it because I don't put on the pounds, you know, the belly don't big? Now I say, oh my God. I say, okay. I say, you're in labor. Now I say, we will not have consent. Which kind of labor? Now I say, well, you see the period. They say about 7 months ago. Now I say, oh, I'm sorry. With this, you're pregnant. And now you're there in early labor. But this is a 50-year-old woman. So it can happen in a distinct possibility. So you need to be very vigilant and very careful. Now, then you pray against, because clearly you can go X-ray where you're not supposed to. And that picking they get right for can sue you up to the age of 18 years. It can still sue you. So that's a big problem. We can talk about that next month, but I tell you what, it's very distinct and it's possible to get Bel at that period. In fact, it's very dangerous at that time if you're not careful. I don't know if that answered the question.
Yes, definitely. Another question is how long menopause can last for?
Yeah, we talk about that. As I say, on average, now 4 years, but above average, it can be up to 12 years. So at the age of, 50, 58, it's supposed to don't complete now. But if they get on to obviously 60 and all that, then perhaps it needs further investigation.
Okay, thank you very much for that. The next person is Sibugi. I don't meet you, man.
Thank you, Dr. Kamara, for this. I hope say plenty women and they from this program today for let them get the information. Not to just before say down the way menopause already, but down the we not begin the menopause yet, because sometimes when you talk about the menopause, we all be dependent thinking that what you talk about, they understand until it happens, right? Dr. Kamara don't talk at all waiting the menopause is all about. But now one thing I want let people understand back for say, like way let people not think for say when they say the menopause, the person don't old now in the old tick self now they never about him business, because a lot of people even when Dr. Kamara they talk, the waiting there for me they get some here. It's like, so I just want let people know for say no more now. Then people ought to go through the menopause because you're still young, right? You're still young, but it just that no more the term don't reach for when nature say this is the end of it. You understand? You're not go able for born picking again, you're not go for I don't call them again. And what you talk about as well, where the man them or where the relationship they can well and during menopause, when the menopause don't come. If we think about the people in Africa, not so they all know about the menopause. Truly, me I think now where I can answer, because I know one day any of my family them talk about the menopause. Maybe certain people and they will go will know about them, but people them the only way they look back now, they remember and say, oh, maybe now that took me mama been the vex way the vex that kind of vex they so. Imagine you go through the menopause, you the sweat boku. That person they know they even know what's wrong with them. What make it the sweat that kind of sweat the way they sweat, so what make it they feel that way they. Now Africa now, where that person they keep quiet again and go say either na do them do or now with human, it not be the witch today, but as he don't keep quiet no more. When if no even know what thing they happen to him body, they say now witch the witch. So it good for like that first gentleman that boy where you say where then they get the information also for pass them back to people. It good. It then a YouTube, the people then listen to them, watch them, and pass them on to people, because now the only way that one day will go learn for say waiting that man they go through, then they go through a lot of phase, that depression, that sadness, for say, oh my God, I'm not going for born picking again. Oh my God, now all are the also, oh my God. All them things and then they go through that man they aid, So if fine for like we support the man self for understand. And I don't go blame the man them. I don't go ever blame them, because they self don't know. They don't know what to make that man they behave that way they, So it's a lot of this education where this world now where we get for like we pass amount to people, so that the man themselves, as Dr. Kamara don't say, for like they support the woman them, not for go back in the street for go get new woman, because it just creates more problem for you if at all that way the man want for things. Let them work together, like Dr. Kamara say, yeah, that woman they don't deal with you for such a long time, all then you say don't support you. If something happen where one day and deny you for anything, then something is wrong, for let them then deal with them, so that life will get back on with the beginning itself, let all man be happy again, one harmony.
Thank you very much. At least you don't begin waiting for the appetite for your next session. We will be the next fortnight. Also, I believe say Uncle Doctor will come with the other parts to this. We go more concerned with demand them, so demand them go understand. Yes, me I not reach that side, but at least it better begin now. So why they get to that side, you know, if I become get nan, people will understand why. Okay. I go to we auntie where they in white. It say Honor 8X. You haven't been on there for a while. You picture the show white, like you wear white vest. You still ask a question, ma? I don't try for unmute you.
Ah, okay.
Yes, ma. Go ahead. Oh, okay, don't take them off. All right. The question, yes, Auntie Hannah. Okay, I'll go unmute you. There you go, ma. Yeah, I don't unmute you. Try for unmute yourself now, your phone. Unmute yourself. There you go. There you go. How are you, ma? Thank you very much for joining me.
Good evening.
Hello, ma.
Yes, I'm so glad for this Zoom meeting here, for this program. You know, I learn a lot from waiting doctor don't talk about the menopause and, you know, the menopause itself and the after. You know, I can give an example because in Somalia here with my colleagues, especially my Ghanaian friend. Sometimes they vex no more. They can don't ask something. Don't they say, Madam Hannah, how do you feel about that? You know, Pastor go ask, I go meet her. I say, Madam Julie, why they behave so? They say, menopause. I say, oh. So today I get this discussion, this meeting here. I'm so glad you don't. Doctor, I'll get a question for ask. I get a message from Nigeria that a woman of 68 years, give birth to twins them. But because this woman, according to your explanation, you said sometimes the menopause, they come very early or they come late. But thinking of a woman of 68 years old giving birth, and the other parts of the question that I want to pose to you is that when a woman, we don't reach menopause, for instance, me as an example, I find out say my vagina is just like somebody we know sabi man business. I say I want to ask why. What is the reason towards that? Where you get that with your husband, your vagina is so tight, waiting at the cause. I thank you all.
Thank you very much, ma. So, Uncle Doctor, now the word that the first one about the 68-year-old woman they say born twin in Nigeria, and the second one now the way how it feel where in the time like say you know one day do one before. So waiting now you answer to that, sir. Uncle Doctor, you can unmute yourself. Yeah.
No, now, you see, I never ever say never in medicine, but I can guarantee you, Mama, at 68, I'm very doubtful of woman will go born twin them for that matter. For one, twin pregnancy is a very high risk pregnancy. At the age of 68, the muscle they're all, remember we talk about Kegel exercises, way down below, clearly the muscle they don't all the week. There's no possibility for let you carry two picking them, you know, triplets or twins or whatever. For that 9 months, you understand? And no expect for leg cesarean section. So there's a few questions I want to ask, you understand? I don't tell you, say, I want to tell you, I say, there was a time when we get one pastor, we they tell you, say, woman that can born live at 68 and all that. What they do, is they go take people and begin abduct them. Within them can begin tell you all kinds jazz and tell you, say, yes, you go born. And the next thing you realize, he tells you 90s, like picking this way, don't born. You know, there's a lot of fantasies, but at 68, I tell you what, if at the age of 40 to 58, this woman know for born, but then he born at 68, well, I tell you what, I know they say no, but I'm very, very, very reluctant to accept, say, this is what it is. I tell you that for free, Mama. I do not think so. Are you with me? I'm not saying that they happen, no. And then like you say miracle they happen. We in science, we always welcome that kind anecdotal happenings, anecdotal in the way they happen. But I'll be honest with you, the likelihood of a 68-year-old carrying twins to full pregnancy or even conceiving at 68 is very unlikely. Very, I don't even know how to put that to you. Wouldn't that be the second question, please?
The second question that at this stage now, they find difficult, like say that the first and they get my papa business with him, man.
Oh, after how long?
Well, given the stage you say they now, now that experience they get.
Say,
they go through.
Not they feel nothing for the man.
No, not to say they feel nothing, but when they do them, it's like that the first time they do them. Anytime we do them, it's like the first time they do them.
Yeah, that's it. That you just proved my point. I'm glad I know one call it, but it just proved my point. Say, in fact, it just go against within the question we asked number one, where say this woman conceive. Because the hormone that women they keep this thing up, they keep them fresh. In fact, I tell you one thing, women then they get more of the infection them after menopause than pre-menopause. At the menopause, before the menopause, women then they absolutely they high up. That particular private part they got with them is so clean as it were, apart from that monthly thing where they happen. But it's so they take care of themselves that with the hormone then they do a lot. Then they increase the immune system. They increase the immune response, clearly. But the fact of the matter is, as the menopause comes in, number 9, that it begins dry. And when it dry, it causes pain. 9 they call dyspareunia. You understand? That dryness there, as I'm talking no more. Now that they cause pain, now that they cause problem, the tightness, and then of course it leads to one thing or the other. Dissatisfaction, problems. But if they use the gels and other things, then the balm, the way they give, clearly. And of course, if it's possible, another contraindication for use the HRT, the hormone replacement therapy, clearly, you can use them and that can help for prolong that period.
Okay. I hope so that it answer your question. Now, I want to ask now, not go the other way now. Family, I hope so now will forgive me because, I should have see you now, I kind of young in a way. But I want to ask, what about cases where people don't reach that stage there for some reason, the woman then become very, very active, even active than when they be younger? Is possible? And why?
Absolutely. But that's not above average. As I've been talking no more. You get below average, you get above average, and you get average. Now, obviously, as I say, just about 4 days ago, one mommy come on television and talk, say, I don't know if this normal, or say, make I ask you no more. He say, at the age of 75, every morning I wake, I feel for a day with my man. Is that normal? Now, your man told themselves and say, oh my God, who's you come on? You know what I mean? That nothing way not normal, but impossible. Say the people in the day. As I say, no more. In medicine, we never say never. We never they say this no go happen. It quite possible say that not just if you like, the term that if you like, a monkey user, not to say user, but a monkey say a freak kind of thing, unusual. But normally, when that thing they don't hang up, i.e. the hormones they don't dry up, the likelihood of that being natural is quite slim. But of course, you get the exception to the rule. And that's what happens perhaps in this case.
Okay, thank you very much. Anybody else there? We get another 5 minutes. So Sisiwugi, you want to use this opportunity for letting you whet people's appetite for your next session? I'll go unmute you. I try for unmute you. There we go.
Yeah.
Thank you very much, man. I get 2 questions also for Doctor. One, somebody they ask, say, if we will do a session on waiting for expect after menopause. That's the first question. I'll get another one, but I will say answer that one day first, and I will ask the next one. Let's try for unmute you. There we go.
Say it again.
If we go get a session on waiting for expect after menopause, if you say that they need a whole session on as a tweaking cover now, we get roughly 3 minutes.
Waiting for expect?
Yes.
In what sense?
Well, that's what the question says. I think waiting possible don't go through menopause. Where the session, where menopause on waiting for expect? Is there anything special we get for happen?
Well, I mean,
Yeah,
Ms. Tamara in session probably go deal
yeah, now
with
that
that.
we can
Or
talk
now
about
you go deal with?
I'm
yeah,
more the psychological side of things than it.
yeah.
So when
Okay.
people talk about the medical side, there's not much more. Now just you go through the trend, as I say, the possibility of a heart attack when the woman they pre-menopause is definitely far less than when you're at in menopause. At that time, cardiovascular diseases they catch up with demand them. So simple as that. They bone them, they become weaker, so they can for them and broke their hip or broke their hand. But of the fracture the way they see now because of the bone getting weaker because of menopause. You understand? Again, the infection the way they get down below, mainly not because of menopause. You know. So the blood pressure goes up, the diabetes catches up, the skin becomes thinner, and then of course the infection will be a bit more delayed, if you see what I mean. You know, it will take a lot longer for heal, you know, for let the person well, you know, and then one thing leads to another. You know what I mean? So there's a lot waking happen, but just take and say now, the thing where the help woman will make woman then get longer life than demand them. If you always watch at the lifespan, the woman then get a longer lifespan because of what you do in the years, the childbearing years, where they call them that 10-week period they go on, then definitely get a lot more protection than we demanded. You understand? But by the time they catch up with we at that menopause, clearly it becomes equal, and some people are even more so than that. So it is what it is, and that's it. But if you want me to talk about the medical side, I can do that. But if you talk about the psychological side or maybe the mental health side, then by all means we can do that, no problem. But I need guidance as to which you want me to talk on.
Okay. There's the last question where it say how you go enhance libido during menopause.
Yeah, okay. I think we don't talk. We do on the slides as well. Then gel them, then cream them, you know, then pessary, ring pessary, you know, and even the HRTO they talk about. If it suits you, i.e., you not get the complications or the the contraindications for use them, clearly not a problem. You can use that, and that can prolong the menopause for setting, and it can make them take a bit more of a backseat. You know what I mean? Because the longer it is, the better it is for you in terms of the time we need the experience. But the end of the day, as I say, you can talk to any chemist, can help you with that. But if you're really concerned, talk to your GP or your primary physician, then definitely get ways and means. Then go send you to even the sexual therapist. They can even send you to them, and there's always help around the corner. But one thing you know for do is shy away. That's all you don't want to do.
One last question, then we'll go wrap up. If girl picking begins seeing period early, then is there any indication for say they go go into menopause early as well?
Now that I've been touched on, that's a very good question. As I say, it is worrying. I think I remember somebody asked me about picking way now, but was 5 or 6 where begin see this blood they come up on. That is not a good sign. The need for investigate that. You know what I mean? A very then called menarche. That means the onset of period. Then so some picking them the age of 10, some picking them the age of 12. You know, then go get for begin see them period. Then so then they see a one, they don't see again for the next 6 months, and then they see another one. Also Monday go see them now continuous. All that depends. But the hormones then they play YO, i.e. up and down. Therefore, at that age they're not stable at all. You understand? That's quite different. As I say, I get 1 minute. The last day I see him, he been unhappy. When I go see her now, beginning of the year before the lockdown, I see them begin pull Bobby, and they say, "Oh my God, what is happening here?" You know, at the age of 10. But that goes to tell you, say, he don't they grow becoming a woman, and as long as you don't begin become a woman, that's what you expect. So the very first one where you get, and then call menarche, usually between the ages of 12 and 14. That's what it's been there. But now it will become a bit earlier. You understand? Now we know people when they develop, then they get, development a bit earlier. So sometimes they 11 years, 10 years, then can actually begin to see that. You understand? But if you get to begin at 6, 8-year-old, clearly begin to see that clearly you need to investigate that. Because it's possible to say now hormonal problem where you get to deal it. And of course, as we be asked the question, at 68, if woman they get period, clearly, if you don't go into menopause already at the age of 50, 58, then at 60, 68, you begin get bleeding. Postmenopausal bleeding, not a good sign at all. You need a gynecologist for such amount.
Okay, but the bit I don't know if that side I miss some. If they see an early, Then they can mean say they can begin see they can go into menopause early as well, or not we can just
as a rule perhaps, but it doesn't follow. No, not to way na steadfast. Na rule way they say if you begin early, if you end early, may well happen like that. It does happen like that, but no mean say na steadfast. Na way enshrined in law. Say if you begin early, if you end early. You know, there may well be some reason we make you begin early, and if that reason there na way na sickness or something. Then you for treat the sickness. No reason, no day for people say this thing not go end at in normal time. If you take care of the sickness, then clearly it go end at normal.
Okay. Thank you very much, Uncle Dr. Kamara. The panel, Cecile Gay, Mr. Ibrahim, and everybody else who don't join from around the world, now UK, Middle East, America, Salon, everywhere else when I find myself at the world, and I thank you very, very much. Cecile Gay, I see you hand up, you want to join in, but please, okay, that's perfect. Okay, on all, thank you. May God bless on all. Now we done so for today. We'll go soon again in 2 weeks. So until we meet again, on a good night.
Thank you so
Good
much.
night.
Thank you.
Thank you.
Good night.